we have come to the second section of the conference, which is related to relooking the GI cancers through functional medicine lens. Yes, we are definitely going a little bit ahead of time, and I am sure, I hope that wouldn't be a problem. Dr. Gaurang Ramesh is our next speaker. With that, I would like to first bring him on stage. Dr. Gaurang, nice to see you here. Welcome to the conference. How are you doing?
Hi, thank you so much, Amarjeet. Like usual, your energy is amazing. I saw a lot of participants also appreciate that you're a wonderful host. Thank you for the introduction.
I had the very tough thing to do that I have to keep the Sunday entertained. Otherwise, nobody is going to be there. Anyway, no doubt about it. The conference itself has been so insightful and so interesting. So many beautiful insights, and we are really looking forward to things from you as well. Allow me a minute to just introduce you. So, Dr. Gaurang Ramesh is a highly respected surgical gastroenterologist who has successfully combined his expertise in surgery with the principles of functional medicine. His commitment to patient care was solidified after he firsthand witnessed that how personalized holistic approaches can dramatically improve patients' health. So today he will be shedding light on how our gut health impacts cancer prevention and overall well-being. He'll be talking about a very interesting thing, microbiome gut cancer axis. So please join me in welcoming Dr. Gaurang Ramesh. Thank you so much for coming once again. The floor is all yours.
Thank you so much, Amarjeet. I hope you can see my screen.
Yes, we can. It's perfect.
Yeah, so today will a lot of GI cancer prevention conversation has happened since yesterday. So today I'll focus on the microbiome aspect of GI cancer prevention. So just a small introduction to GI cancer. It's right now in the top five most common cancers in India, both in male and female, and in when you combine both sexes also. And the problem with GI cancers is that we pick it up at a later stage, especially when today, because of the genetic predisposition, we are seeing a lot of youngsters having GI cancers, and we never suspect youngsters, even if they come with loss of appetite, loss of weight, and bleeding per rectum, we tend to neglect GI cancers. And the early screening involves invasive procedures. We'll have to do an endoscopy, colonoscopy, and people are not willing to do tests easily. So that is one more reason why we pick up GI cancers very late. So now today, when we have to talk about how we can personalize prevention of GI cancer, we are looking at combination of genomics, epigenetics, and the microbiome. So yesterday we learned a lot of how to understand the epigenetics and genomics. Now today I will talk about the microbiome, and then we'll look at how we can combine all three of them. So microbiome is a recent discovery of in the human body. Of course, we always knew that there was a microbiome, but the function of the microbiome and its importance has hardly been 10, 15 years since we have discovered that. And we have more human microbiome genes than our human genes in the body. And it's about 1,150 times larger than the human genetic complement. So that's how important the microbiome plays in the gene expression as well. So in functional medicine, since yesterday we have been talking about how everything can influence our health. And it's exactly the same for the microbiome, that everything around us, the epigenetics, the environment can influence the microbiome. When you look at diet, we only think of what feeds the human body. We look at micronutrients, macronutrients, but we don't really think about what is feeding the microbiome when we eat food. So everything in our environment, right from our hygiene and the pesticides, the chemical exposures, can influence the microbiome. And when you look at the body in systems biology perspective, we realize today that the microbiome is having an impact on all the nodes in the systems biology. Whether it can be the detoxification, it's responsible for phase 3 detoxification, energy production, the short chain fatty acids is produced by the microbiome, and the metabolic components and in structural integrity, the intestinal permeability is affected by the microbiome, and also the hormones and the nervous system. So now we realize that it's not just helpful in simple digestion. We need the microbiome, healthy microbiome for the protective functions, for production of antimicrobials, and for the integrity of the gut lining to be intact, for the mucosal immunoglobulins, and for the intestinal barrier function, and for various metabolic functions. So the gut microbiome can actually shape a healthy immune response in our body, or it can predispose us to the disease. So that is why, to understand how it's impacting cancer, we need to understand what exactly is dysbiosis. So dysbiosis is a shift in microbiome that causes an imbalance between the beneficial bacteria and the pathogenic bacteria. So there are different ways this dysbiosis can happen. It can just be loss of beneficial bacteria. It can be excessive growth of harmful bacteria, or it can be loss of overall microdiversity. And but the problem in microbiome is we have not yet been able to define what is normal. So there is a lot of variation in based on the geography, based on the environment, based on to an extent genetic predisposition also. So because there is so much of variability, we still haven't been able to define what is normal microbiome. So when we are not able to define what is normal, dysbiosis is more of what the effect the microbiome is having on the body than the microbes itself. So it's basically the relationship between the host and the microbe. So we should not look at dysbiosis as a classic infection. Uh, Dysbiosis can present in many ways. It can be a simple bloating and discomfort and indigestion. Two, it can present it has dermatitis and autoimmune conditions. So we have to look at what is the pathogenic inflammatory response the body is giving to the dysbiosis, and look at the body as a whole. So what is contributing to dysbiosis? So since yesterday, whatever we have discussed about the environmental contribution, epigenetics, all of them is can contribute to the dysbiosis. The diet, like I said, we don't think about what feeds the bacteria. We have labeled many nutrients, phytonutrients, polyphenols in conventional nutrition in the past has non-nutrients. So though they are the ones which is feeding the bacteria. And recently there is so much conversation on resistant starch, which was also not, we never realized that in the clinical nutrition previously. So all of that is feeding the bacteria. So when we starve the bacteria out of not giving it the fiber it needs, the polyphenol it needs, phytonutrients it needs, then we contribute to dysbiosis. Stress can contribute. Infections, especially if it is not treated uh, completely. There are two problems I see nowadays happening. Is one where patients are have abused antibiotics, and they start developing antibiotic resistant infections. So even they take a lot of time to cure the dysbiosis. On the other end, people who are afraid of antibiotics and allopathy, they don't take it even when it is required. So even in those kind of patients, we see a low-grade infection contributing to dysbiosis. And all the diseases can have a role. The hormones, Mahesh was explaining, hormones can have an impact on the microbiome. The enzymes, if it's not properly digested, the undigested food can have an impact on the microbiome. So, what this dysbiosis does is it has a direct impact on the intestinal lining and it alters the intestinal permeability. So once the intestinal permeability is altered, we develop food allergies, malnutrition, and lipopolysaccharides infiltrating our bloodstream, and that predisposes us to the systemic disease. So at each step, there can be contribution to cancer. So let's look at how. So to tell you in simple terms of intestinal permeability is basically the tight junctions between the cells of the intestines are affected, and what is not supposed to get absorbed starts getting into the circulation. We call it the leaky gut, and that causes gives opportunity for the bacterial toxins, endotoxins like lipopolysaccharides to also get into the bloodstream. And the endotoxins, whether it is the lipopolysaccharides or the bacterial metabolites, which are acting as toxins, can lead to various different problems. From the liver hepatic inflammation to neuroinflammation to developing insulin resistance to activating our autoimmune issues, and it can contribute to the systemic inflammation. So this dysbiosis and intestinal permeability can present, it's there's a lot of variation in how the patient presents. So if it is a simple um, permeability issue, the patient can just have little bloating uh, in the gut, but having other symptoms in the skin or metabolic issues or hormonal issues. From that, it can go to an extent where the intestinal lining is inflamed along with developing other extraintestinal autoimmune diseases. So how is all this influencing cancer now? So microbiome can have both anti-tumor effect on the cancer and a pro-tumor effect. So uh, everything I have explained, the intestinal permeability, endotoxins coming in, leads to systemic inflammation. And since yesterday we have been discussing that inflammation is at the center of carcinogenesis also. So these inflammasomes and endotoxins from the bacteria can increase the production of tumor necrosis factor IL-6 and IL-8 and create a environment ideal for the cancer. And this we have seen very well in H. pylori. H. pylori is one of the most common bacteria existing, and I'm sorry, the Vaccae and Kage produced by the H. pylori can increase reactive oxygen species. It can increase inflammation and create ideal environment for adenocarcinoma to develop. This is something which is also difficult to treat because about 20 to 25% of the people can develop and easily can develop antibiotic resistance to H. pylori. So the functional medicine way of treating the gut is very helpful in reducing H. pylori. And this is a key way we can prevent stomach cancer and lower esophageal cancers. Another example we have seen of the microbiome contributing to inflammation is the Fusobacterium nucleatum in the colon. So this bacteria can increase the signaling of toll-like receptors in the colon epithelium, and that decreases the autophagy and also increases chemotherapy resistance. Uh, The second way the microbiome is affecting is by the metabolites it's releasing. So there are many metabolites uh, which are anti-cancer also, but some of the common metabolites like secondary bile acids, which is converted from the primary bile acid by the microbiome, can play a huge role in promoting DNA damage, induction of apoptosis and necrosis. Another example is the hydrogen sulfide released by some bacteria can also contribute to oxidative stress increase. And there is enough evidence in colorectal cancer that hydrogen sulfide released by the bacteria is contributing to the progress of colorectal cancer. And the third aspect is the translocation of the bacteria. So because of the intestinal permeability, the bacteria is getting translocated. Initially, it's just the endotoxins, and then you can also have independent bacterial translocation, which we have seen Enterococcus fecalis and Clostridium species playing a huge role in liver metastasis because of the bacterial translocation. And here we also have a new concept of which we are understanding now is the tumor microbiome. It's the oncobiome concept where the uh, microbiome of the tumor itself is playing a huge role. So this is actually creating a hypoxic situation and making it ideal for the tumor to grow. It is also producing metabolites, which is causing angiogenesis and making ideal for the tumor progression. And sometimes when we optimize the gut microbiome, it can have a beneficial role on the tumor microbiome. And another very interesting concept in our body is if you, even though we don't always see direct evidence of bacterial translocation in the blood, we see the microbes communicating throughout the body. You see in, for example, we have spoken about the fungal overgrowth. So fungal overgrowth in the gut can increase the chances of skin yeast infections. It can increase the chances of sinus infections. We have seen that in COVID also, that the the virus is coming through the respiratory tract, but it's creating significant changes in the GI tract. So we are yet to understand exactly how the microbiome is communicating across our body through the metabolites it's releasing through the neurobiochemistry. But there is definitely a lot of evidence today that the tumor microbiome is also playing a huge role in either the progression of the tumor or regression of the tumor. So how do we understand microbiome today is by the polymerase chain reaction evaluations. Uh, we have taken so long to understand microbiome because we were relying on the stool cultures and stool microscopy where we could not understand the diversity. Now, when we can exactly identify the species of the microbiome, it started off with the 16S RNA sequencing, which was concentrating only on the bacterial species. But today we have the total microbiome DNA sequencing, which can give us information of the all the other kingdoms also, and also we have information on uh, the functional information and the metabolites released by the microbiome. We can now combine the microbiome information along with other information we get with the stools, like the enzymes like pancreatic elastase, the bile acids, short chain fatty acids, and also we can combine the information with the urine organic acid test. So how do we combine? We are in the verge of having complete personalized medicine with the omics revolution happening. I would just like to give a small example of how I'm using the genomics in my practice. So I don't have a huge experience in this, but some of the patients have tested with the GCC omics panel test. where the cell count of the tumor is done and the chemosensitivity is assessed by the genomics. And we can also look at the gene expression of the tumor cells and how other metabolites are interacting with the tumor cells. And we can see the chemosensitivity of the chemotherapy drugs and also the chemosensitivity of the natural extracts. So now we all know that it's not just the genomics. Genomics makes very less value in clinical practice. So we'll have to look at the epigenetic effect of the genomics. So it is possible today to look at the tumor-related gene expressions. So every gene we know which is playing a role in tumor progression, we can see whether it is being overexpressed or underexpressed, and then we can decide on which natural extract to use. Today, even in natural extracts, the research is growing, and we know exactly what are the natural extracts to use in various pathways of the tumor progression, especially the anti-angiogenic mechanisms. So we can exactly identify that in this onconomics panel test, and then use the specific natural extracts. And this is also helpful for the chemotherapy selection also. So this is where we stand today. But if you think about in how fast the machine learning and AI is moving, in a couple of years, we will have enough technology to understand the microbiome report, correlate it with the urine organic acid test report, correlate it with the genomics and the gene expression report, and then give us a personalized report to really look at how we can target cancer prevention. Now, finally, to conclude, I would like to talk about what can we do to optimize this microbiome. So, like I said, microbiome is, we cannot look at it species wise. We cannot look at it in a reductionist perspective. We have to look at it like an ecosystem, like a forest. So in a forest, to create an ideal, you can consider your organic farm as your microbiome. So in an organic farm, what will you do to get the ideal garden is the first we have to remove the weeds. Removing the weeds doesn't always have to be giving a strong antimicrobial agent, but it can also be things you do to make it hard for the weeds to grow back. So, depending on where the patient is in the spectrum, whether it is a pathogenic bacteria or a microbe, we can use standard antibiotics and botanical antimicrobials. If it is just mild dysbiosis symptoms, we can usually manage with the food and probiotics and prebiotics. And then we come to seeding, and which is actually the giving a supplement of probiotic. So how does probiotics help in cancer? So directly, we have seen research that there is the modulation of microbiome can improve the immune system. So today we have learned how to specifically use beneficial bacteria in our foods and use fermented foods to improve the immune response, to improve the gut health. It also has a lot of antioxidant properties and also anti-cancer effects. So I can leave some information about fermentation of foods and how it is very important. So the magic of fermenting is it's not just the bacteria, but it also has the bacterial metabolites in the food, and the anti-nutrients in the food has been reduced in the fermented food. So it's like a holistic way to biohack our microbiome. So once you seed, you'll have to feed the plants. So feeding is by the diet. So the prebiotic is a substrate that is selectively utilized by the host microorganism and then gets converted to a metabolite or a postbiotic. So we have to be very careful in using prebiotics in a dysbiotic gut, because if it is, your gut is not yet prepared by removing the pathogens, by optimizing the digestive enzymes, then the prebiotic can actually have an impact on the dysbiosis in a negative way, and it can increase the bacterial translocation and worsen the dysbiosis. So it's very important for us to move from north to south, do the fundamentals, optimize the digestion, chew the food properly, make it easier for it to digest, and then look at once the bloating and abdominal digestion is better, you introduce probiotics, and after that, you feed the probiotics with the fiber. So why am I talking about fiber in cancer is the butyrate. So the bacteria feeds on fiber and produces short chain fatty acids. And the short chain fatty acids is what is having the epigenetic effect on the tumor progression and tumor prevention also. So for a balanced microbiome, we need to optimize all three aspects, the prebiotic, probiotic, and look at how we can increase the postbiotic. And quickly, there is impact of all the lifestyle changes which we have discussed in the last since yesterday morning on the microbiome. It can be the fasting, it can be the exercise movement and reduction in stress and in optimizing the circadian rhythm. And when you look at the gut-brain axis, all aspects of the communication from the gut to the brain, it can be from the hormonal signaling or the brain neuropeptides and the neurochemical pathways of the vagus nerve. Everywhere the microbiome is having an impact. So it's very important uh, for the brain also to optimize the microbiome. So I would just like to close the session of how I go through a patient of dysbiosis. So the first approach I do is always a food first approach, and then only look at uh, if a lot of investigation is required and antibiotics are required. So I get a lot of information when we do a detailed dietary recall and ask patients to maintain a journal and see the correlation of what exactly is contributing to the dysbiosis and gut symptoms. And then we have to work and look at what uh, the patient is many times what we happens with the dysbiosis and IBS is we have preconceived notions of certain symptoms and we disregard the patient's story. So that basically it should be avoided and look at how we can reiterate and listen to the patients all the symptoms to get a hang of where exactly the dysbiosis is happening. Is it the problem in the digestion absorption or is it the problem in intestinal permeability, gut microbiome? Is there any systemic inflammation contributing to the dysbiosis or is it a nervous system issue contributing to dysbiosis? And then I do the removing, replacing the enzymes and inoculating the bacteria and balancing. Only after doing this, I see if I need to test further because, as all of you know, the costs involved in the testing. And we always have to remember that gut microbiome is like a garden and it needs constant attention. It's not just the prescription we give, but also the lifestyle changes the patient will have to do. So, and any other issues also coming in, we try to look at the gut first and how we can treat the gut to then have an impact on all the diseases. Thank you so much for giving me the opportunity to present in this conference.
Thank you so much, Dr. Ramesh. I could see so many eye opening expressions which were coming in while you were giving the presentation. Such a beautiful presentation regarding the gut microbiome axis that you were talking about. Um, in the interest of time, I'm just going to take a quick question which I could see. So, Bhavna wanted to know how can we test for low stomach acid?
Yeah, so to test low stomach acid, we have invasive tests like the 24 hours pH metry, where we put a probe into the stomach and evaluate the pH in the stomach and the pH in the esophagus. Uh, that would be a hospital test, but a simple test would be either a sodium bicarbonate challenge test or an apple cider vinegar challenge test to see whether you have gastritis or just low stomach acid only.
Can you throw little bit of light in another 30 seconds how to go about
Yeah.
with it?
Yeah. So, apple cider vinegar, taking 2 spoons with half glass of water in empty stomach, or even 1 spoon of it in empty stomach will, if it makes you feel better, that is means that there was low stomach acid. If it makes you feel worse and you have upper abdominal pain, that means the lining of the stomach is not yet ready to start treating the low stomach acid. Low stomach acid can be there, but we still have to treat the lining of the stomach first and then treat the low stomach acid. One more thing, it's good that you brought it up, is we have to remember the number one risk factor for lower esophageal cancer is reflux disease. So, if we overtreat low stomach acid with a lot of things like apple cider vinegar or beta HCl and not identify that the reflux is continuing to happen, that may again, create a risk factor for cancer development. So we have to be very careful when we are treating low stomach acid also, and we have to do it at the right time. The lower esophageal sphincter has to be optimal. There should not be reflux, and the gastritis should have healed. Then you introduce things like apple cider vinegar and lemon juice and all that, and then you can optimize.
Thank you so much for your insights again, Dr. Ramesh. I could also see a couple of questions coming in right now. So, in the interest of time, I would just request you to be on the backstage and also answer the questions, probably in the chat box or in the Q&A section. All right. So, thank you once again, Dr. Gaurang.